Welcome back to Cycle Wisdom, where we empower women to restore natural menstrual cycles, to improve health, and promote fertility. I'm your host, Dr. Monica Minjeur, and I'm so glad you're listening today. What if recurrent irritation, odor, or that stubborn brown bleeding at the beginning or end of your period isn't random, but a signal that your uterus or cervix are sending that something is off with your microbiome, which is the overall composition of bacteria that naturally reside there? Today, we're going to translate what normal really looks like, when to suspect imbalance or chronic endometritis, and how cycle-informed care restores comfort and supports fertility. So let's get started with a patient story about Ray. Now, Ray came to see us when she had been trying to conceive for about a year. She worked in marketing and noted that she felt embarrassed and discouraged because she would have cycles going back and forth between being okay, and then sometimes she would have days of odor or burning after her period. She also noticed with her charting that she had 2 to 3 days of brown bleeding before and after her menstrual cycle. Now, Ray had tried multiple different over-the-counter products over the few years and noticed only temporary relief at best. She had tried different vaginal washes, as well as changing her underwear and other things, but none of it had really made a significant improvement in her bleeding patterns or the symptoms that she felt. She knew that there may be a relationship with these concerns to her inability to get pregnant, and so she came to see us for additional evaluation. Now, her charting did reveal that brown spotting 1 to 2 days before menstrual cycle started and 2 to 3 days after her period. She had a fairly consistent ovulation time, but she did have a little bit of shortening of her luteal phase. It was about 11 days on most cycles. She did have a medical history that was significant for multiple infections of bacterial vaginosis in the past, which is an overgrowth of bacteria that many women get. It is not a sexually transmitted infection in most cases. She did let me know that she was using a liner in her underwear every day because she had concerns about the mucus discharge that was fairly consistent, and she wasn't sure when bleeding could happen. Early on in her evaluation, we started with a pelvic exam and cultures in order to look for bacterial vaginosis or yeast. Now, these came back actually negative for Ray the first time that we did everything, so we also evaluated for chronic endometritis and had her send in a menstrual sample blood test. This test confirmed that she had dysbiosis or irregular bacteria that was making up the microbiome or the environment of the bacteria that was in her uterus itself. We treated Ray with targeted antibiotics for that chronic endometritis for the bacterial overgrowth, in addition to overlapping with both oral and vaginal probiotics. We also discussed the importance of cotton underwear, not synthetics, avoiding the panty liners when possible to allow better airflow through that area, and focusing on making sure she was identifying if any of that irregular bleeding came back. Within the next couple of cycles, Ray's irritation and odor resolved. Her brown days had decreased to just a half day prior to her menstrual cycle starting, and her charts were much more clear. So let's look at the big picture a little bit. And I know we've recently talked about chronic endometritis quite a bit. I did a whole episode back number 113. So if you want more specific information about chronic endometritis, you can go listen to that one. So as we look at the big picture here, if we're not sure exactly what's going on to start with, we need to identify what is normal first. Now, the normal genitourinary tract for women is there should be lactobacillus that is dominant. Lactobacillus is a particular bacterial species that is considered to be good bacteria, and most healthy vaginal ecosystems are dominated by that lactobacillus. Lactobacillus produces lactic acid, which helps to maintain a low pH, so it tends to seem like it's more acidic. This discourages overgrowth of other organisms. Now, there is absolutely some variability that exists, but persistent odor, irritation, or bleeding can suggest that there's an imbalance there. Something else that is very, very important to understand is that the vagina, cervix, and endometrium or uterine wall lining have related but distinctly different microbiome communities. So, for example, if we do a vaginal swab, this is checking only for what's going on for the bacteria in the vagina. It is not checking for what is the specific microbiome of the cervix or of the uterus itself. So it's important to understand that just because you have a normal culture swab that is done at your regular primary care office, it does not rule out issues with the cervix or the uterine wall lining. And why this is important for fertility is that, yes, vaginal microbiome plays a huge role when it comes to sperm survival and transport, as well as the ability of your body to have normal bacteria present to avoid infections. However, inside the uterus, chronic low-grade inflammation can also impair implantation and increase your miscarriage risk. This oftentimes shows up as brown spotting at the beginning or the end of your cycle, and sometimes even during the middle parts of your cycle. Unfortunately, in some cases, brown bleeding isn't present at all, and chronic endometritis can still be present. So it is very challenging to diagnose it. It is challenging in some situations in order to treat it effectively and to make sure that it goes away. Now, there are lots of things that you can do at home in order to try and help encourage a good microbiome. And where I usually recommend starting is to say avoid any excessive cleaning in the vaginal area. Many times we find that patients are so worried about treating any odor or discharge that may be occurring that they're utilizing scented washes or douching or repeating over-the-counter antifungal treatments. And this oftentimes can actually worsen irritation because we are getting rid of the good bacteria that should be there. So I would just really want to urge you that if you are somebody who deals with what you feel is chronic infections, please get evaluated, get checked out by somebody who understands what is normal, what is not, so that if you are treating with something that you are getting appropriate treatment and only when it is necessary. So how do we evaluate for this and what would we do for treatment? As we discussed with Ray's case, we always are wanting to check and see what is your history, what does the charting show us? Checking those vaginitis and culture tests. And again, that's just looking for what might be going on in the vagina itself. And then consider evaluation for possible cervical ectropion or inflammation, which is a change of the cervix itself. And if there's persistent brown spotting, consider that menstrual sample evaluation looking for chronic endometritis. We also want to make sure that if you have persistent bleeding or persistent issues, we want to consider a pelvic ultrasound in order to rule out any sort of polyps or fibroids. Now, when it comes to treatment, again, it is so important to make sure that we are treating the correct condition. So, for example, if you have bacterial vaginosis, an overgrowth of a normal bacteria that can be present there, we do specific antibiotics that are designed to treat bacterial vaginosis. The other thing, which is fairly new within the past couple of years here, is that it is recommended also at this point in time to treat any of your sexual partners as well, because we know that this can be something that is carried, especially in male partners. And so we want to treat both partners to avoid recurrence. Again, always wanting to make sure that we're focusing on getting the pH accurate, building up that good lactobacillus, so avoiding any fragranced products, any unnecessary washing in that area. If we find that there is a yeast or fungal overgrowth, we utilize targeted antifungals, but again, only in cases that it is confirmed that's what's going on. If you have chronic recurrence of yeast infections, again, we want to look at and understand why it's reoccurring. So a very common cause that we often see in our practice is women that have elevated blood sugar readings. So if you have insulin resistance or excessive carbs or sugar in your diet, that could be a very common reason for having recurrent yeast infections. Sometimes it can be that it is passed back and forth between you and your partner. So in some situations, we will treat your partner for anti-yeast medications as well. And then the other common one that I oftentimes see is that women who completely shave off all of their pubic hair or wax or have it removed, we oftentimes are removing that protective barrier that can prevent infection from developing in the first place. So in some cases, we do recommend avoiding complete shaving. You can certainly trim, that is fine. But some cases we say don't completely shave off everything because in some women, they are more sensitive to that process of shaving and it can decrease that extra layer of protection that the hair can provide. Now, I did mention briefly previously cervical ectropion. So what this is ectropion is inflammation of the outer surface of the cervix itself. We're going to talk more about this in a couple of weeks when we talk about other reasons for bleeding. But this ectropion or inflammation of the cervix can cause some issues as far as light spotting or irritation after intercourse. And in some cases, it can present as continuous mucus discharge. And so these are the cases where we say we want to make sure this may just be a normal situation or it may be this overgrowth of bacteria. So again, understanding what is going on helps us to discern if we need to treat it or not. And then finally, focusing on some of the lifestyle changes that we can make. Again, if you struggle with balancing female microbiome, or if you have troubles with feeling like you have odor significantly being a problem, or irritation that comes and goes, always make sure that you are wearing breathable cotton underwear. If you are somebody that exercises regularly, change out of your damp clothing as quickly as possible after a workout and avoid any sort of tight material that may be decreasing your ability to dry out in that area or may hold too much moisture or sweat. Again, avoiding any sort of internal washes or douching and only utilizing unscented, gentle external washes in that area. We like to say in our world that the vagina is a self-cleaning organism. It does not need soap introduced to it. And if you do, that's oftentimes when the pH will go out of balance. During intercourse, utilize only water-based, sperm-friendly lubrication, even if you are not currently trying to conceive. The water-based lubricants that you would utilize don't have any of the harsh additives that can alter the pH or irritate the tissue. If you're somebody that is more sensitive to your vaginal irritation, we also recommend avoiding any oils. So sometimes people will use olive oil or coconut oil for intercourse, and avoid saliva because this can also introduce more irritation and add to the causes of infection. During your menstrual cycle, consider using a menstrual cup or disc and make sure that if you are using pads or tampons that they are unscented. Try to avoid daily panty liners unless it's absolutely necessary because again, even if the surface is cotton-based, they oftentimes have plastic on the adhesive side of that liner, which then decreases the ability for it to be able to breathe and typically will hold more moisture in place. So how do I know what exactly is going on? Is this bacterial vaginosis? Is it yeast? Is it microbiome disturbance? Again, the only way that you definitively will know is to check with a doctor, have a vaginitis test done, have a culture test done, request to be sent in evaluation for chronic endometritis if necessary. But really the only way that we know definitively is to get that actual test. Now, there are some certain signs that can lead us to believe it might be one thing versus another. So, for example, bacterial vaginosis oftentimes has a smell to it that some women describe as a fishy odor. It generally is going to be a thin, clear, or watery discharge, as opposed to a yeast infection typically is going to present as thicker discharge. Sometimes people will say it's more like white or clumpy, and it's oftentimes accompanied by significant amount of itching. However, it is common to have overlap, and I frequently find that some of my patients will have both bacterial vaginosis and yeast together. This is why it's so important to check a vaginitis swab rather than just running to the store to get an over-the-counter treatment that might not take care of the whole problem. Along those lines, we oftentimes get asked, will probiotics alone fix this? Now, probiotics can be helpful, but in many cases, we need to treat the actual infectious cause first. So treat the overgrowth of bacteria, treat the yeast infection first, because probiotics alone typically aren't going to be enough to overcome the excessive overgrowth that has been happening in the first place. So what about brown spotting? Is brown spotting always chronic endometritis? And the short answer for this is no. Now, we do always want to consider it as a part of one of the possible diagnoses, but brown bleeding at the beginning or end of your cycle can arise from many different causes, including hormone imbalance, cervical ectropion, polyps, or fibroids. And we always want to look at what is your charting cycle pattern showing in addition to targeted evaluation in order to decide if chronic endometritis is causing issues. Okay, so what if I'm trying to conceive? Can I still try to conceive during treatment? The answer to this one is sometimes, but we oftentimes will focus on completing treatment and confirming resolution first to give implantation the best chances possible. We frequently recommend treatment for your partner as well so that we're clearing infection completely for both of you, and we generally recommend to avoid intercourse during this time so that we're not passing any infection back and forth. If you are someone who has already suffered the loss from multiple pregnancies and recurrent miscarriages, we do typically recommend avoiding trying to conceive again until we can see how effective treatment was, because again, we want that uterine environment to be just right to allow implantation to occur. Okay, so if I have to wait, how quickly do symptoms improve? Vaginal symptoms, if you only have bacterial vaginosis or yeast, symptoms typically will improve within the course of a few days to a couple of weeks at the most. Typically, treatment for that is pretty quick. However, chronic endometritis, or those infections that are living in the uterine wall lining itself, often does take a bit longer to resolve. Now, treatment course typically takes place over the course of an entire cycle, so almost a full month, but we oftentimes will see that that endometritis will take a couple more cycles beyond that to heal the uterine wall lining even after the infection is gone. So this is why it's so important, again, to understand what is being tested and treating. Again, a vaginal culture alone cannot check for chronic endometritis. Don't just treat with over-the-counter medications without knowing what's going on. So stop treating blindly and schedule evaluation with somebody who understands the differences in these things and is able to help you to discern what is the appropriate treatment. Imagine if vaginal irritation, bleeding, and odor disappeared and the lingering brown bleeding resolved because you worked with a doctor who helped you identify the underlying cause and treated it precisely. Over the course of a couple of months, your bleeding patterns can improve and your irritation can resolve, all to improve your overall health and promote fertility. If you're ready to work with our elite team of healthcare professionals, go to our website, radiantclinic.com, to schedule a free discovery call and learn more about our package-based pricing for comprehensive care. We are currently able to see people for in-person appointments in our Cedar Rapids, Iowa clinic, or can arrange for a telehealth visit if you live in many different states across the U.S. Check out our website for current states that we can serve medical clients, and let us know if your state is not listed to see if we can still cover you there, as we are constantly expanding our reach. Please note that our fertility educators are able to take care of clients no matter where they live. Thank you so much for listening to this episode. Please share this podcast with someone in your life who would benefit from our services. Remember to subscribe to this podcast for more empowering content that I look forward to sharing with you on our next episode of Cycle Wisdom.